Health Center Generations, and we had a nice chat there. You want to start a little bit about your background and how this all happened?
Absolutely. I'd be more than happy to do that. So rural health has been a passion of mine, Representative, for a very long time. I was a Peace Corps volunteer in the middle of Peru, working in rural health. That got me started. Then I went on to work in state public health, working for an association that represented all the state secretaries of health. And then after that, I spent a long time in the federal service, working internationally with the U.S. Agency for International Development. Then I applied to a job here in Connecticut to lead the Rural Health Transformation Program. Your listeners might have heard about that program, but just to give those of you who may not hear about that a quick recap, that is a new federal program. It's $50 billion over 5 years, and with $10 billion allocated to all 50 states for 5 years. And what's exciting is that Connecticut, for year one, actually, of this project, we received $154 million. So that's quite a lot of money that we're really happy to port towards improving rural health access and also outcomes in many of the areas that you just mentioned. And so to make sure that we're on the right track with that program, we have conducted a number of different visits to meet with community leaders, constituents, hospital executives, heads of federally qualified health centers, basically you name it. We've really tried to kind of get out there and to talk to people to make sure that what we have planned in the way in which we're going to be spending those resources across 30 different projects, to make sure that we're doing it the right way. So I'm really excited because we've really gotten some great feedback from the folks living in your area in the Northeast, but also the Northwest as well. Thanks.
It's wonderful, yes. I think that we had an excellent meeting when we met with the hospital administrator, Donna Handley, and also the people who are the administrators of the Federally Qualified Health Center here in Generations in Eastern Connecticut, talking, and also the administrator from Day Kimball Hospital, which has had a recent transformation, as I'm sure you're aware, where they have now become partners with UConn Medical Center. And so we're taking a look at, really developing these areas of healthcare access, and we could drill down into some of the ideas that have been brought up, if you'd like. Like, for example, some of the things, behavioral health care is an issue that we talked about a lot when we were meeting at Generations.
That's certainly a priority, and one of the things that we've heard from community members that they would like us to tackle. So it is one of the focus areas, I'm pleased to say, of our program. For example, our colleagues at DEMIS in the state government, they are going to be working to scale up crisis stabilization units, which are basically 23-hour emergency room-like kind of facilities that will hopefully alleviate the pressures that I know emergency rooms face across the state. But that's not it, and we're certainly not stopping there. We're also really excited about some of the other programs. In fact, I think during the same meeting, we had heard about the issues about workforce, and that I know it can be challenging to attract and retain providers to some of our rural areas. And so we're going to be really investing with a full court press to make sure that we can build a pipeline of rural healthcare providers from basically the high school level, starting to educate people about why those careers are important, all the way up to licensed practices and ensuring that we have rural practicums. Because what we know is that if people and providers do start their rotations or the residencies in some of their rural areas, rural residents and rural hospitals and other facilities are really good about convincing them to stay. And that's what we want them to do. We want them to stay in our rural areas to practice there. So I'm excited about that too.
Hi, Dan. I'm Dennis O'Brien, Susan's husband and partner, law partner. We're both lawyers, and we've both had a lot of experience working with government agencies. Right now, I'm doing a lot of work with towns in the eastern region here, Chaplin, Andover, and Eastford, smaller towns, but we live in Windham and Willimantic. And, I read over some of the paperwork on the internet in addition to your email, and I learned a little bit about this program, and wow, I was blown away by the fact that Medicare, Medicaid, federal is spending this kind of money on this need that I'm sure is true is in place all over the country. And one of the things I thought about when I thought about your position with DSS and working with up to, I think, 10 agencies you're going to be working with, 10 state agencies, including your own. What an exciting job it's got to be for you, because you're not in Montana or Utah or, more rural states. You've got rural areas in the state, but it seems to me as though with your experience and your the capability of Connecticut state government agencies, including DSS, I think it's a dream job. I bet you're excited about getting into this.
Oh, 100% I am, and thanks for just bringing that up. It's really a joy. Come to work every day is something that is that you're passionate about. Really makes a difference. I don't know how many people can say that they go to a job that they're really excited about every single day, but that's certainly the case for me. The chance to work with really leading experts all across the state in every single one of those 10 agencies, each with their own specialty, their own set of experiences, their own expertise. It's really exciting. And I hope that at the end of the day, at the end of those 5 years of our program, that Connecticut residents in our rural areas will be able to say, gosh, I can see the state government bringing the services to where we are. Because I think for too long, many of our rural residents have had to have traveled too far to get the care that they need. And so I'm really excited because via this program, we're going to be really trying to bring some of those same services closer to the communities that I know that you guys know very well.
It's wonderful, and we're very, very focused on how that will be coordinated with the existing hospital and the nonprofit Generations, which is a federally qualified health center, and also the behavioral health providers. All those providers that we have, CHR, we have different mental health providers, they came to our meeting, and you want to talk a little bit about some of the interactions and things that you found out when you met with everybody at Generations.
Absolutely, and let me just start by saying that the Generations team there and the leadership at Generations were the best hosts that one could possibly ask for. They did a fantastic job in convening community leaders, in really setting the stage for a great conversation with colleagues in your area that know a lot more about health situation than I will ever know, to be honest with you. And so it was really great to soak up their expertise. I think we all agreed that health should not really depend on where you live. We know that if you live on this zip code or that zip code, that shouldn't be a reference point. We should really have a way of guaranteeing that people have access to good health outcomes and just access to services. And so I think during the conversation, we talked a lot about how to kind of work together. One of the things that I'm excited about is that we're going to be setting up a system of what we're calling regional collaboratives. And that's just a fancy word for trying to set up task teams working together between Northeast and Northwest Connecticut, so that folks who have that type of experience at Generations or hospitals and other community groups can really share lessons learned about what works. And so we don't want to reinvent the wheel. That's not the intention of this program. Instead, we want to learn from the people that have been at this for quite a long time. They know a lot about what works and what doesn't. And so that's really the purpose of hosting these meetings, is to get out there, to learn from folks, to hear about what are some successful practices that we can adapt for this particular program. And then what are things that we've tried before and just simply don't work. So we want to stay away from those as well, too. But it was a great discussion, and I was really happy to be surrounded by so many community leaders who had so many good pieces of advice to offer my team and I.
That's wonderful. And so one of the things that is not just, it's all over the state, but certainly in rural areas, it's more difficult to find universal home care for people who have, needs once they're in a hospital or a nursing facility, they want to go back home, having access to home care visits from all different levels of care. That's something that, and when we get into the more rural areas, it gets more and more difficult to provide. Based on that information that we discussed, how will that be coordinated with the rural health care subsidies? Daniel, you there?
Yeah, can you hear me? I'm on, if you guys can still hear me.
Yeah. Oh, yeah. Oh, okay. So I was just wondering, in terms of the home care services that we need, whether you're someone who's just getting out of the hospital, going from nursing home to home care, straight from the hospital to home care, or a child that has behavioral health and or physiological problems that needs some skilled visits from nurses and other types of providers. How will that's a difficult thing for us to manage in more rural areas because of the cost of moving between one house to the next or one building to the next. I just wondered, what have you looked at so far trying to manage rural home care services?
Yes, that's a great question. And I think you're referencing problems that can be challenging to crack, and I appreciate you bringing those up. What I would say is a couple things. Number one, I would say that one of our core mandates is to really bring the services closer to where people are, to make it easier for them to access those same services. What do I mean by that? Well, for example, our colleagues at the Department of Public Health under this program, they're going to be working to scale up access to mobile clinics so that, for example, medical and dental teams can get out to see communities, can bring their experts just to where they're around the corner so that people don't have to travel too far to go see those experts. Also, with our colleagues over at the Department of Public Health, we're very excited about a program in which, for example, community paramedics and EMS providers, perhaps when they're on their downtime, we can send them out in their vehicles to check up on people, maybe people who have recently come out of the hospital and require some follow-up care, or others who might be battling chronic conditions. So that's one way in which you're doing that. One of the other ways that we're also going to be working under this program is to expand a very successful program, and that is something that our colleagues at the Office of Early Childhood have really started up, and we're going to be expanding that program. It's called the Family Bridge Program. And what this looks like is that when a postpartum woman is out of the hospital, then this particular program sends nurses and other healthcare staff out to check on the postpartum woman, as well as her newborn, to see how she's doing, to really try to assess the health care of the neonate, so that we can really ensure that infant has the best start to life. And so I'm very much pleased with how we're going to be able to expand this program under the Rural Health Transformation Program, because it's about programs like that we know work, that we're going to be applying, and we're going to be scaling up so that they can cover more people.
You talk about the Family Bridge Program, because here in this part of the state, we have a limited access for maternity and delivery services. So having the Family Bridge Program really addresses part of the difficulty that happen after a woman gives birth, either to the child or to the woman. And you can have infections, all kinds of different problems that someone might, as someone who's maybe the first time having given birth, thinks, oh, that's just the way it is, and then find themselves in a very dire situation. So tell us a little bit more about that. I know that the Bridge Program was started in Bridgeport, and I'm just thinking about how that Bridge Program will work out here and how the referrals will be made. I know that the maternity and delivery care at the Windham Hospital is not generally done there. It's done at the Norwich Bacchus Hospital, or perhaps at Manchester Hospital or Hartford Hospital. So tell us a little bit about those coordinated services.
Yeah, and that's a great question, because I think coordination is really the key. How do we make sure that if you're a patient who needs those kind of services, how that they're getting those? So our colleagues over the Family Bridge Program, they've been doing this for a while, as you referenced, Representative Johnson, and I think we can really build on their level of expertise, because they have learned a lot through that program. For example, that current program is serving approximately 3,600 births per year. and that we have 1 to 3 nurse visits per postpartum woman. So it's really trying to look at those 6 months of Nate's first, life, an infant first life. When, as you said, that's a particularly challenging period because, as you said, there could be an illness of some kind or infection that could start out as something that's fairly simple, but if not treated and diagnosed correctly, then could be a larger issue. So that's really the purpose of the program, to bring that care closer to the women and families who need it. And so I think you'll see that in the community themselves, as these teams are hitting the communities and getting out to see the folks in their homes. So I'm very much pleased to hear that that's getting ready to get started and will be expanded.
Yes, that's great. So that goes kind of to the education pipeline, doesn't it? Because we have UConn here, we have Eastern Connecticut State University that's joined up with Hartford Health at Wyndham Hospital to do educational opportunities to create more access for more providers to create the more access for health care. And they also have Quinebaug Valley Community College, and the high schools are helping with training as well for the nurses' aides.
Absolutely. Workforce is a huge part of this. And I think, Representative, you and I have talked about this previously, that workforce is one of the biggest issues, right? Because it's hard for some of our health systems to attract the kinds of specialists and primary care physicians and others that they need. So under this program, for example, we will be trying to build a coordinated rural health workforce pipeline, basically from high school to licensed practice, and really focus on the sustainability, right? Because what I certainly don't want is us to build this marvelous program over the 5 years of the program and then it to kind of dissipate. We want to try to build sustainable models that really work. We're also going to be working on, as you mentioned, the certified nurse aide program. That's exciting because it'll allow us to expand the training and educational opportunities associated with that. What we know is that oftentimes our certified nurse aides do want to practice in the communities where they're from or where they live. And so that is a particularly successful program that I think will help us at a slightly different level to be able to get the types of human resources that I think many of our facilities desperately want to attract and retain in their communities.
Absolutely. And then there's also, I think, people that go in to become nurses' aides. They want to become an LPN or an RN, and having that opportunity to continue to grow your education as you work, I think that's a big deal. Any of those things, are those being discussed as well with the groups you're working with?
Absolutely. That's very much a focus. We're delighted to be working with our colleagues over at UConn. They have a lot of experience. They bring depths and decades of experience trying to help figure out innovative ways to help address our health workforce needs. So that's good. That partnership is going to continue. We're really excited to be working with that group of folks because they bring such a clinical, educated, and research-informed way of looking at workforce issues. So there's a lot to come there. I think that'll be very new and interesting for our community members in the 5 years of this program.
Absolutely, and I think that when you look at the community colleges, that Ken or Mohegan, for example, had been providing RN training, so that's a 2-year program. I'm not sure how or where the LPN programs were, but they were at the tech schools, some of them, at the technical schools. And then having that step-by-step process going all the way from nurses aide to LPN to RN to APRN, those are the kinds of things that, we want to see happen. And those are the kinds of things that help people grow their income, and is kind of thing that we need in terms of having access to people that can be providers for those situations. I remember when I chaired the Public Health Committee that we, during the horrible tragedy of Sandy Hook, that we really didn't have any psychiatrist, really, that could be available to the extent that we needed them, and to the extent that the pediatricians were saying, hey, we need more people with behavioral health expertise. And so here we were. We actually, during that time, we created an opportunity for APRNs to operate on their own after working with a doctor for 2,000 hours. So they had that independence. And one of the things about psychiatric APRNs, or APRNs that do behavioral health, is that they have the capacity to be like a nurse, a social worker, and somebody who can also prescribe medications when they work in conjunction with a doctor. So are you looking at those kinds of things as well?
Absolutely. I'd love to learn more about that program. It sounds like it was a really successful program, Representative Johnson. So I'd love to hear more about that. I'm glad you mentioned behavioral health and mental health. Those are definitely focus areas as well. For example, we have a program called Access Mental Health. That'll be working to really pair timely psychiatric consultation and training for adult primary care providers, because as you probably know, and probably even better than I, because you've been working in this for even longer than I have, that primary care providers themselves are oftentimes in short supply, but then certainly trained psychiatric providers are even more in short supply. So this will be really trying to help pair the two. We'll be using some innovative technology to also help with that. There's been a lot of kind of progress made in telehealth and remote patient monitoring, means kind of wearable technology to help with folks. So we're really excited also too about not just making sure that we have the people physically located where the patients are, but if we need to, we can bring in experts too with the telehealth capabilities that I think will be worked on with this particular grant too. So we're trying to approach the problem from a number of different perspectives and ways.
This is fabulous. We have wonderful sponsors. Gates GMC is going to be intervening for a few minutes, sponsoring Let's Talk About It. Daniel Sinclair, we will be right back after these messages. Sinclair.
Okay, and all right, gotta get your name right, Daniel. You're gonna be you're gonna be well known all over the place by the time you're done. You're doing a very important job, and I like I said before, I think it's a dream job, and helping people. I was a judge of probate for 12 years before I aged out and had to retire, but and before that, a legal aid lawyer for 23. And I'll tell you, you get a great feeling from doing something that's going to help people in need, and you have got that opportunity big time. And from what you've been saying with your conversation with Susan, I think I'm so optimistic about the results. And I don't want to put you on the spot, but I mean, I think you're off to a great start already. And I one of the things I learned when I was judge of probate, I dealt with a lot of people in need, and I think that what you're doing with this program, I think in general, to some extent, one of the items is increasing opportunities for preventive care. And that is so important, so important. When I was judge, I saw there were people with illnesses who some eventually passed away because the illnesses they have were not identified in time. And I think that reaching out to the rural communities like you're planning to do, and making sure there are more opportunities for them to get preventive care is a real important thing to do.
Absolutely. I couldn't agree more. And, it's interesting because it looks a little bit different depending on who you are, right? So I was just up in Northwest Connecticut meeting with the hospital leadership for Sharon Hospital yesterday. And what was clear to me was that area, for example, has a high number of older folks, older adults. And so they've really been thinking a lot about, well, how do we make sure that the services that we have for older adults who needs them are really well equipped to both reach that audience and to give them what they need. So we talked a lot about that yesterday. One of the things, too, that you'll see under this program, our colleagues at ADS in the state government are going to be working on scaling up exercise classes, because we know that if you can really help older adults with exercise classes, that can help with fall prevention strategies. And as we all know, nobody wants our older adults to have any issues with falls. So it's a great strategy to help folks in that age group to stay fit. For other folks who might be outdoor enthusiasts, for example, in your neck of the woods, we're going to be working with our colleagues over at the Department of Energy and Environmental Protection, and they're going to be really helping to make the airline trail more accessible to folks, cleaning it up, making sure that it can really appeal to so many different folks, and we know that trail is well used. So I think you'll see some benefits in this program as well, because we know that, just as you were mentioning, if folks have healthy lifestyles, then they have decreased risk, I should say, of chronic illness. And so we all want that. We'd want that for our grandparents, our sisters, our sons, our daughters, and everybody. So we really are also trying to go upstream a little bit with this program, and also try to figure out, well, how do we help people adopt healthier lifestyles? And so the couple examples that I just mentioned are some of the ways in which we're trying to do that.
Well, we have a guy that does the morning show here on WILI, and he is always talking about how he's out on those trails. And he's not a young whippersnapper either. He's younger than I am, but not that much younger. And he's out there on those trails constantly. And I'm glad you brought up the trails. That's a really great idea to make them as welcoming as they possibly can be. And also, I think, word of mouth, people will talk, and more and more people will use the trails. I think things just get better and better and better that way. Speaking of exercise, I can't agree with you more. In fact, after we get out of here, speaking for this senior citizen, not for Susan because she's so much younger, when we get out of the studio, we will be heading to the gym tonight. So we agree with you completely on that one, completely. I just wanted to ask one more question, Daniel. I didn't get whether, have you been in the state for a long time?
No, actually. So I'm a relative newcomer in complete transparency. So I have a lot to learn from folks who have been working here like yourselves. I have only been in this job for, a little bit over 4 months, but my team and I, we're up to 9 people at the Department of Social Services. They are absolutely fantastic. And I just want our listeners to know that they are literally working around the clock. There hasn't been much sleeping going on. There hasn't been too many weekends going on. It's been a lot of work to get this $154 million that the federal government has decided to invest in our state, get that into projects. So we're really excited about the progress that we've made, because I think before too long, we'll be able to have some more formal announcements about exactly what that'll look like and how each of the 30 projects that our 10 sister agencies are doing, what that actually will look like. So people will start to see those teams in their communities, will start to interact with them, and I think a lot of good can come of it.
Well, that's fantastic, Daniel. You've only been here 4 months, and already you've learned a lot about Connecticut. And Connecticut's a very interesting place. I've lived here all my life, and I've left here a lot for travel opportunities, but not. It's been my home since birth, and very interesting place. It's very diverse in a lot of ways, and it's geographically diverse. And it is diverse in terms of, urban, rural. So in a relatively small state, you've got everything here, and you're going to find not only a great place to work in, but a very interesting place. So I'm gonna let Susan talk now. It looks like she's ready to say something. Thank you, Daniel.
I can't help myself. But anyway, thank you for that. One of the things that I have been thinking about at the Capitol is the fact that we're probably losing some Medicaid coverage, and some of this may be helpful, but one way to maybe help people with the loss of the Medicaid coverage fits in nicely with what you're talking about: exercise, diet. I just recently started a diabetes caucus, so people will start looking to see if they have family members with type 2 diabetes. If they do, they can limit they can be pre-diabetic. if they look at their diet and that sort of thing. I just wondered, would health information for the public through meetings, through Zoom, through opportunities, through Generations, or at the hospital be something also that you might be looking at?
Oh, 100%. There are so many ways for people to get involved in this project. In fact, I don't think it's something that we should just be nice to do. In fact, I think it's absolutely essential that we hear from our community members. Folks in your district, Representative Johnson, are living the reality of rural health care. And this is not a program that we want to be baked in Hartford and then to be handed over to folks living in Willimantic. In fact, it's the exact opposite. We are actively seeking input from folks all across the state in our focus areas of Northeast and Northwest Connecticut. What does that look like? Well, so far, my team and I have gone out to, I want to say on 4 different site visits, depending on kind of the location. We've held a series of different webinars that we're now, I think, going to be putting on our 4th webinar in August. All told, so far for the first 3, we've been able to attract almost 550 participants in those webinars. So that kind of, to me, signals the level of interest that we have. We've had a great opportunity to brief lawmakers such as yourself, Representative Johnson, in your capacities as folks with oversight of different agencies, including the Department of Social Services. While this program is not Medicaid, some people do ask that, is this a Medicaid program? This is separate from Medicaid. It's kind of a different appropriation, but it's something we definitely work hand in hand with the Medicaid team over the Department of Social Services. But I will also say, just kind of finally, that we have a weekly newsletter that also goes out. That's very simple. Believe me, it doesn't spam people. It's not like we have reams of information for folks. We usually try to just pick 1 or 2 highlights. So if people do want to kind of get involved and hear the latest updates about what's going on, then certainly they can do that. They can look for Connecticut's Rural Health Transformation Program, and there's a tab called Public Engagement, and right there you can easily see how to sign up for those weekly updates. So really an opportunity for people to contribute their advice, their comments, their suggestions for how we can ensure that these programs really benefit folks living in our rural communities.
That's wonderful. And one of the things I would ask you to do is to include me, send that to me, and I would be glad to include it in my e-blast. As everybody knows, perhaps, I send this show out by every week. So people can hear it at the Capitol. So you can go on my website at susan.johnson@cga.ct.gov, and you can hear and see all the shows that we've done here for the last several years. This particular show is going to be blasted next week, not this week, because Press 8 is on vacation, but he will be back, and we will be blasting this out. We'll be giving it to you, Daniel Sinclair, and you can blast it as well with your weekly information. But I would love to have more conversations with people about their health care, what their concerns are. The other thing that we have here that a lot of the other towns don't have is we have 3 homeless shelters here. And I'm not sure what the story is in the northwest corner with respect to homeless shelters, but we have a huge need in a rural area for people to be housed, and having the Holy Family Shelter, the Project Hope Shelter, and the Domestic Violence Shelter, all shelters that are, many people are in need of, some type of health care oversight. And I didn't know if that was going to be part of the information that you were going to be looking at, connecting, the services for rural health care in this kind of a circumstance.
Well, it's a great question. I will say that we've had some initial conversations with our colleagues over at the Department of Housing, and they've had some really good ideas about how we can work together. I think that coordination will continue. But if there's specific suggestions as well too that some of the colleagues who have been working in that space for a long time have for us, I'm happy to connect with them and to learn more about that. I think we can always do a better job in rural health. That we can't be satisfied with the status quo, but we really need to make sure that the programs that we have envisioned under this program really are transformative. It's in the name of the program, right? We have to be transformative. We have to be thinking outside the box. So would love to the opportunity to engage with the folks that you just referenced to see how we could potentially coordinate.
Wonderful. I think that would be a great meeting to have with all the homeless shelter providers, and especially the ones in the rural areas. And I'm not sure how many other rural areas actually have homeless shelters except for us. So it may be we're the only ones. I'm not sure. But that would be another way to take a look at the resources that we need to try and take care of the population in this area. And as we look at the different levels or different spots where people need health care, a couple of other things that have come to mind, that is the types of facilities that might be available to people. Of course, you have the hospitals, then you have the skilled nursing facilities, the nursing facilities, and then you have the rest homes. All those different levels of certification require different types of care and access to care. We have all three of those types of things here. We have a hospital, we have 3 nursing facilities, and we have a rest home, a certified rest home here. Those are the kinds of coordination, if expanded, we could really, I think, make a lot of transitions from different types of levels of care. Home care, for example, if you're in a certified rest home, then it becomes easier for a provider of home care services to come in and provide those home care opportunities for people that are there.
Yeah, and I think the goal is to have everybody working in unison, right, and to coordinate care across the entire ecosystem of health. One of the biggest parts of our investment, actually, especially for the first year of the program, is actually going to be oriented towards our 4 rural hospitals. So we have Windham, of course, which you know very well, Representative Johnson, Day Campbell up in the Northeast. We have also Charlotte Hungerford and Sharon Hospital. So a lot of our first areas of effort will also be going to really shoring up those facilities, to helping them get the ideas that they just have never had financing to do, but put them into practice. And I think once we're able to share some more details of what that actually looks like, people are going to be blown away, because those 4 hospitals and the leadership teams that they have really come up with some creative ideas about how to expand access to care, how to kind of push the envelope with some technology and services and healthcare workforce staffing that I think people will immediately notice once we get these programs off and running. So look out for that as well. I think there's going to be a lot of support that we're going to be having for those hospitals.
That's wonderful news, because I think that they really need to have that support. Hospitals have requirements that other providers don't have. They have the emergency maternity and delivery requirements, the EMTALA requirement. So they have to take whoever comes in the door, and they don't necessarily get paid for that. So EMTALA is a big deal for the hospitals, and if people are not covered either by Medicare or Medicaid or private insurance, then the hospital gets left with the actual cost, and it could be where the person is going to have trouble getting discharged into a proper facility after that. So one thing that I should mention about our Windham Hospital is Congressman Joe Courtney has actually been able to create a Medicare hospital. This is the only hospital in the state of Connecticut that was deemed a Medicare hospital, which meant that the reimbursement rates were higher than other hospitals that took in Medicare patients. And so because we're so rural, and because we have right here in Windham, we have about a little less than 25,000 people, 13,800 are on the Medicaid program. We hope that continues for them. But we are looking at a problem that could arise and not having coverage for some of them. and that also would have an impact on generations. So those are some of the worries that we have right now. I know that the Medicare hospital designation went out of effect in 2025, but I didn't know if you were aware of that designation.
It's not one of those things that I can consider myself an expert in my first 4 months, Representative Johnson. So I need to organize another coffee chat so you can educate me a little bit more on that. It sounds like you have a lot of history, and I'm a history buff, so I would love to soak that up and learn about that experience.
I would just love to have you here talking to the folks here. We have a senior center. They have a time where we could actually probably set aside some time for you to meet some of the people. That we could have coffee and talk about some of these issues, because having this kind of chat on Let's Talk About It on WILI has been a great deal of fun for me, because my background is, as I made you aware of, is the Medicare and Medicaid programs and Social Security, disability, and all types of insurance coverage for people that have injuries and illnesses.
Well, I mentioned the diversity of the state before, Daniel, and having listened now to some of the nuances that we have here in Windham, which is a town of about, the census has us at 24,000. I would argue that it's more than that, but that's what the census says. We do have all these facilities, and, we have people from all over this region, and many of whom live in, I would say, circumstances that are more rural than we are sitting in right now here in WILI studio. But we are a rural hospital here in Windham, as Congressman Courtney did make sure that we are. And we are definitely a rural area. As you pointed out, you've already learned that the two most rural areas in Connecticut are Northeast Connecticut and Northwest. And you got that down pretty good, but the nuances are incredible. And Susan Johnson, my wife, is the right person to fill you in on all that. And if you come out for coffee, I'd like to join you as well.
You're certainly welcome to join us, husband Dennis, co-host Dennis, partner Dennis.
I would look forward to that a lot, Daniel, and that would be great. And it would be very, very interesting for me, as somebody who's always been interested in the same kinds of issues that you'll be dealing with, keeping people safe in any way we can. Police, fire, healthcare, all kinds of ways to keep people safe. It's, along with education, the two number one priorities for me, and also for Susan.
Absolutely. And, the idea that we're out here, I think we mentioned at the beginning of the show, having a rural area means that there's longer periods of transportation time in between visits with people and those kinds of things. We're winding down to our last 3 minutes, so I want to give you a chance to cover stuff that we maybe didn't cover yet and have some final words. So go ahead.
Well, let me just start off by saying that Representative Johnson and Dennis, I'm really just thankful for the opportunity to come on your show. Similarly to the colleagues at WILI, I just really want to thank them as well for giving our chance to talk about this program. I just would like to leave you with maybe two things. The first is that this program bears with it in the $154 million that the federal government has entrusted to us, a tremendous responsibility, one that we take very seriously at the Department of Social Services. We know that this is very valued money that we need to put to work. And the money can really unlock some doors that I know need to be opened. For too long, people have had to travel for too far to access the care they need. And via this program, I'm hoping that we can change that. And then the second thing that I would like to leave your audience with is that this program only works as if we hear from the community members. I want to be accessible. I want to be visible. Our entire team knows that. We have a whole bunch of more site visits planned to come out and meet with colleagues in your area. We want to come out and hear from folks. This is not some program that will just be administered from the Capitol, and you'll never see us. You'll see us perhaps too many times so that you'll be like, I hope these guys don't come again, right? That's kind of where we want to be. We want to be at that level so that we can be involved and learn from your set of
It
experiences.
won't be too many times for us. We're very much interested in what you're doing, and I want to invite you to come back and give us progress report every so often, whether you're on the phone or whether you were in studio with us, because we'd love to have you here in Windham Willimantic, and I'm sure that I know the station would like to have you here, and our producer Keith C. Rice would love to meet you as well from WILI, and he's a real superstar here on the station, along with Wayne Norman, and we just would like to keep in touch with you and make sure our listeners are well informed about your progress.
We thank you
very
so
much
much.
like that, and I would appreciate that.
We thank you so much for being on the show. Daniel Sinclair, the Executive Director for the new program, the Rural Health Access Program. Thank you so much for being here. It's a wonderful Rural Health Transformation Program. Thank you.
Great. Thank you so much. Have a great weekend, everybody.
Fantastic, Daniel. We'll be back next week with another great show. Thank you, Keith C. Rice, for producing the show for us today.
You got it.